All right. Well, welcome back to our Innovators of Health podcast. Today we have an extremely special guest. I'm Jadev Karande. I'm here with my co-host, Dr. Rahul Desai, and our very special guest today, Dr. Matthew Young. Welcome to the podcast.
Thank you. Thanks for having me here.
So, to quickly introduce Dr. Young today, you know, uh, it is such a privilege because he's one of the leading voices shaping the future of implant dentistry. Dr. Young is based in San Francisco. He's the founder of Young Dental SF Group and has more than 25 years of clinical experience in reconstructive, aesthetic, and surgical implant dentistry. He serves as the president of American Academy of Implant Dentistry, holds diplomat status with the American Board of Oral Implantology and Implant Dentistry, and is an honored fellow of the AAID. His career has been grounded in three core pillars: education, credentialing, and camaraderie. And he's now advances into the highest leadership seat of AAID. He has lots of achievements, but beyond the achievements, you know, Dr. Young is a husband, father, youth sports coach, and I believe you grew up in Buffalo, New York, right?
Yeah,
Is
that's
that correct?
correct.
And you've got and your parents were educators.
Yeah, both my parents were teachers. They instilled, the importance of education, importance of learning, importance of giving back to community. My father was also my Little League coach and president of Little League. So got to see at an early age what it was like to be able to work with the community, work with sports, be active with sports, be outside,
Hmm.
exercise, enjoying the sun and being around people. I think it's awesome.
So from research, doing my homework and research on you, Dr. Young, I'm just blown away by your origin story. So maybe we can start there. Kind of give a let's talk to our viewers about how you got to where you are today, some of your inspiration and your journey.
Yeah, thanks for having me on today. I love working with you guys, and for me, medicine and dentistry and having everything come together, it's been a great part of my career. I'm very active, like you said, in organized dentistry. I've spent a lot of time volunteering for different groups, and to be able to have an impact in the American Academy of Implant Dentistry is great. You get to see a lot of the research that's coming through. It helps me with my practice. I remember going through dental school, and I loved dental school. I loved the art and science of dental school. I loved to see how everything came together. I remember very specifically my junior year of dental school, we had our first course on dental implants. And our instructor talked about changing patients' lives, taking them from a situation where they didn't have teeth, they couldn't function, they couldn't go out and enjoy lunch with their friends, they couldn't go out and smile with their family. And implants were a way to change their life dramatically and give them that joy again, be able to taste food, be able to eat, have that self confidence. And from that moment on, I said, this is what I want to do. This is what I want to do with my career. So I really positioned things so I could learn the most about dental implants, surrounded myself with great mentors and great leaders over the years, did a great residency program for implants, became associated with American Academy of Implant Dentistry. We do a lot with cutting edge research. The success rates for implants have gotten better and better over the years. The downtime after dental implants have improved. People are back in action. We can do immediate implants now, and it's really a game changer. So it's a fun time to practice and fun time to see how my practice has developed over the years.
Oh, that's amazing. What keeps you inspired for the future of implant dentistry?
Yeah, it's inspirational to see the changes, to see all the changes we have. We can do things faster, better, more efficient, and more comfortable for the patients. Digital technology now has been amazing. We can do all of our plans digitally, so we can be more minimally invasive, and we can have the implants placed in the ideal position, so we have the best amount of bone in the safest position, and then develop the restorations. I also have some really cool things with biologics now. We do a lot with platelet-rich fiber. I take the patient autologous blood, use it in a centrifuge, and so we can develop growth factors. We have a liquid PRF that we can use and inject into the surgical areas and in our graft materials that enhances the body's immune response and the bone graft potential. And we can also make membranes out of the platelet-rich fibrin to enhance the bioactive healing. Also have great things with red light therapy and photobiomodulation. We've been using lasers for years with photobiomodulation. It helps to decrease inflammation, which decreases surgical swelling. Anytime we have decrease in inflammation, surgical swelling, we have a better chance for the body to heal properly. Less pain and discomfort, but also better healing. Now we have red light therapy. Red light therapy I know you guys talk about a lot. Red light therapy has been great for us in our office, and it's great for me. I use red light therapy also, and for patients, it's been working awesome.
Yeah. Dr. Young, can you talk a little bit about that? Just how it's affected your, with the photobiomodulation, the red and near infrared light. I'm interested as a busy clinician with, uh, healthy practice and a big family at home and just all of the other things that you're doing. Uh, how has it impacted your personal life?
Yeah, it's a good question. Jadiv said, all the things that I do, and sometimes you hear all those things, and it's a lot to balance and manage. And I think probably about a year ago, I was getting more tired. I was getting more tired with things, and needed to make some changes. Needed to make some changes, and developed a whole new protocol. And the red light therapy is a very important part of it. I use red light therapy and personally in several different ways. One, I really appreciate now the benefits of early morning sun. That early morning sun has the red light and the near infrared light, and the wavelengths are longer for those wavelengths, and you get the best in the early morning at the end of the day. So I really try to get outside and enjoy the sunlight in the morning, do morning workouts. On days where not be able to get outside, I use the red light therapy. I use the red vibe, the red light therapy. It helps me to wake up. It helps get the body ready for the day, and it helps to get me more active throughout the day. I also use it at the end of the day at nighttime. The body's programmed through years of evolution to understand that at sunset, the body starts to shut down. With all of our lights and blue lights and monitors, that gets lost. But I've changed my end of the day protocol. So at the end of the day, I have more time to decompress. I use the red light therapy at nighttime before I go to bed, and I'm sleeping so much better than I have in years and maybe forever. I sleep really well at night. I get more deep sleep and restful sleep, and I find that is much more productive way to go the following day. I used to stay up very late and working on spreadsheets and getting all the plans going, and sometimes not enough sleep. And so now, making sure I have that restful sleep, I'm better for the following day. I have more ideas. I'm more energetic and better with the team. So it's helped me in a lot of ways. Really, really a game changer for me.
Beautiful. Yeah, I mean, I'm an evangelist for that too. I've been doing that
Yeah.
for a couple of years now, and it's literally completely changed my life and my body and health. How is that feeling? And I mean, even for I know your family's maybe using it a little bit. Mine, I have 5 children; they all use it. Wife uses it, and if, one of my children's going to have a surgery coming up here, and she was actually preconditioning. They're going to take some hardware out of her knees,
Yeah.
um, and we were actually preconditioning her for this week, just prepping the skin and the tissues for the surgery. So it's been pretty incredible. How has that impacted or translated to work now that you're feeling those benefits? And how do you how have you taken that to work? And have you seen any impact there yet? I know that's a more recent transition.
Yeah, we've used photobiomodulation with the laser for years, and I've seen the changes in muscle pain and jaw pain. Um, for me, I like to know how things are going to work first. So you guys know that I've been using it myself. And I found that for muscle aches and for recovery after workouts and after exercise, with the red light therapy, it's much more improved, much faster. I work out hard. I get the workouts in, muscle training and cardio. And they used to be tired and sore for days afterwards after those.
Mhm.
But now my recovery time is much faster. So when I started to see those changes, we can have those same changes for patients as well. During a procedure, we're doing surgery, even though we stay as minimally invasive as possible. These are surgical procedures, and having that red light therapy come in, it helps to decrease the inflammation of the jaw. It also helps to develop ATP for the mitochondria, which are really our power horse and our workhorse for the body, and allows us to heal faster and recover faster. So recovery times for implants with photobiomodulation and using the red light and near infrared light works out great. And it's a soothing effect, and you can see those benefits.
Biologically, are you excited as far as implementing this into the clinic? I know we've had you know uh, membranes, bone grafting, the PRF and the advent, um, with osseous integration and the even change in microbiome and all those things. Are you excited to look at those changes, or do you see some of those changes yet? Or I mean, and it's in the literature, but
Yep.
extending that into like the clinical practice. Uh, what are the things that you're as a clinician looking for or excited to see with that implementation, especially at home, right? That they're going to be able to take this dosing, that it really changes from an in-clinic experience where they're getting this very specific dose. It might be a higher dose, but this that one time where now they can extend the walls of your clinic.
Yeah, if we can enhance the healing effect, if we can enhance the ability for the body to work for itself, getting down to the cellular level where each cell is working better, working more efficiently, that's going to help our surgical outcomes, and it's going to help our healing. A lot of people, once they start to go through implant therapy and improve themselves, they go through a whole ability for a life change. They say, I'm doing this, and I'm getting better. And I've seen so many patients over the years who have ailing teeth and failing teeth, and teeth are falling apart, and they don't feel great. They don't feel great. They don't feel great about themselves, and they want to make some changes. Implant dentistry can move them into this. And now with the red light therapy, they can see those changes throughout. They can see the changes in their energy. They can see the changing of their complexion. Can have more of a glow afterwards. It definitely is great for skin. It helps the skin. It helps you feel energized, and and that goes into the whole way that the body works. So the implant therapy that we can provide is one part of it, but then having those changes where they can feel those life changes. That's really the big impact. The ability for somebody to smile. Many patients don't want to smile. They've been masking their smile, and it usually takes people about 3 to 6 months to really retrain those muscles. It takes much more energy to have a frown. You have to pull all the muscles down. The natural muscles are to go up. So once they develop that ability to smile again, they feel better. And then once they start to feel better, they can have more energy. And so the red light therapy at home definitely goes in line with that ability for them to have a restful sleep, have the feeling of being more energetic, and really taking care of their whole life and whole body. So I think it's all part of the medical and dental treatment, and this is how we can affect the patients the most way.
That's beautiful. It's really changing just listening to you and hearing your passion. It's really about changing the trajectory of their life. Like
Yeah,
yeah, amazing.
yeah, it absolutely is.
Is that something you've developed yourself just from your observation and your experiences, or is this something that uh, y- um, you share with your peers across the board in the implant dentistry field? Would your peers feel the same way as you do? Is that something that you all promote?
Yeah, that's the great thing about being involved with organized dentistry is that you go out and you talk to people and you connect with people and you interact. So some dentists they kind of stay in their practice and they don't get out in the community as much. And I hope that they get out and talk to people, because once you start to talk to people and you feel energetic. We have a big conference coming up next month, and you learn a
Mhm.
lot from the main podium, and you learn a lot from the speakers. A lot of times, you learn just as much by talking to your colleagues at lunch and dinner about the positive effects that they can have on their patients. You say, "Wow, that is great." I'd like to incorporate that into my practice. How do I incorporate that into my practice? And then you have a colleague you can talk to and connect with. And you really want to do surround yourself with people who are doing well professionally and with family, and it rubs off on each other. You get that
Yeah,
excitement, you get the feeling, and you're like, all right, this person and Idaho is doing some great work, and I love it. I love what they're doing. This person in California or right here in my backyard, there's someone I can talk to and hang out with. So you want to have that. You want to have that energy, and you want to have that human connection to each other. And you want to talk to people who are doing some things that are different than you. That's how we learn. And you might be doing one technique and one protocol, and you talk to somebody else, and they're like, "This is working very well for me. Here's the research that we have on this," and you can start to incorporate it into your office. So yeah, you start to grow with each other and feed off each other, and the benefit is the patients, and when patients are happy, then you're happy, and your staff is happy, and it really combines to a great way to practice.
that's great. You just mentioned your conference, which we will be there. We'll have a presence,
Yeah,
and Dr. Desai here is gonna speak. So I know he's excited about that.
yeah, I'm really excited for Dr. Desai to speak. We do a lot with photobiomodulation, with overall health. We've been doing courses on PRF and skin rejuvenation, and we do a lot with implant surgery. So I'm really excited for Dr. Desai to lecture. This is going to be our American Academy of Implant Dentistry annual meeting. It's going to be November 12th to 15th at Phoenix Convention Center. I have a lot of great programs, and very happy Red Vibe is going to be there. And Dr. Desai, I think our group is just going to love his presentations, and it's been a life changer for me. So I think a lot of people want to understand this the science and technology.
So for
Doc,
anybody
I'm
curious,
sorry.
no,
Go ahead,
I
Jay.
just was curious. For anyone who's curious, I mean, listening to this podcast, hearing you speak about it, um, from even an implant dentist perspective, who is familiar, but maybe they're skeptical. What would you say to a skeptic? In terms of, hey, what have you been experiencing in your own clinic right now with patients since you've been using it, or how would you approach that conversation?
But yeah, I think start off by looking at the literature. Looking at the literature. Red Vibe has great literature, great library. You can look at other literature on red light therapy and how red light therapy can work and how it can help. The benefits of the wavelengths and how it affects the body, how it gets down and actually affects the body. Sunlight is so important, and we see changes with sunlight. We're not always have the ability to get that right type of sunlight, and that's where the red light therapy and near infrared therapy can really help out. But I would encourage them to try it for themselves first. This is something where they can try it themselves. They can see how it works. They can work it with their family, and then incorporate it with the office. I think that's a great way to have an entry point. You can't necessarily place an implant yourself, and not everybody needs
Mhm.
surgery. But this is something you know invasive that you can do and try, and they'll see the benefits of it.
Do you talk to the patients, or how do you uh, extend that therapy kind of longitudinally? Because that's as we did regenerative medicine, it became really apparent that the patient's kind of baseline health was critical to the outcomes that we were performing. And I hear the same things with implant dentistry, right? From just overall health, their diabetic status, any issues there, their oral microbiome, all those things that can be leveraged when you're talking to patients about this type of therapy, and especially long term. Are you having those conversations? Because this is something that we're really passionate about. That device is never going to be put away, right? So when they take this sort of red and near infrared device home, it sounds like you're saying those things, but I'm just interested to understand like how you have that conversation with them. Is that something that you have after their implant takes and is doing well? Is it something that you discuss like earlier on, or what is your kind of segue into? Don't put this in the closet after we're done with the implant.
Yeah, we go through a lot of that with the initial consultation. overall health, understanding what kind of medications they're on and what type of medical issues that they have. Overall periodontal health is very important. The bacteria that destroy teeth can affect implants as well. So looking at the whole mouth and getting them healthy is really a key. You mentioned diabetes. Diabetes is one where, for somebody who's uncontrolled diabetic, they have a lot of systems that are failing, and we can't expect implants to be successful. But controlled diabetics, patients who are controlled diabetics, we still have implant success rate of about 92% implant success rate.
Hmm.
So working with their physician, understanding, what their conditions are, and then moving them in a position where they're implant candidates and then long-term implant success. We also talk about multivitamins, the importance of multivitamins, importance of vitamin B is very important. B12, B complex are very important for overall health and overall healing. I love vitamin D3 and K2 for the liquid drops are the best form to put under the tongue. It helps with our bone growth. And then in line with bone growth is light. Sunlight or the red light therapy is what activates the vitamin D and vitamin K to develop bone growth and bone potential. That's how
Yeah.
everything goes together. So, it's all part of it. I tell patients after, we do surgery and we do sedation. I said, go home, take some time to relax. I say, tomorrow, you don't feel great. Try to get outside. Get outside, feel that fresh air come in, have some sunlight get to you. You're going to feel a lot better. If you sit inside all weekend, you're just not going to feel as good if you get outside. If you feel tired, just walk around the block and come back. But try to get outside and moving around. That moving around is going to have them feel a lot better. I text all my patients after a surgery and I say, are you getting outside today? They're like, yes, I'm going out. I'm getting outside, and people appreciate it, and they appreciate the feeling it gets, and it does help them grow. It helps them, improve and feel better. So, yeah, all those things go together, and, it's amazing once you start to get people in and, starting treatment, you continue with it.
Are you leveraging the aesthetic side too? Because it sounds like there's some other things that you're doing as well, and it would be a good fit with the. I mean, you've noticed kind of complexion changes. I've noticed them
Yeah.
as well. Almost all the patients that we've talked to, that's one of the things that comes up is sleep and skin. It
Yeah.
seems very very obvious. What are the things that you're doing in the clinic? Are you really focused just on implantology, or are there other things that you're doing?
Yeah, as far as implantology, that's your smile. That's what people see. So, in line with your smile is your face, your skin, and all that works together. So the skin effects of the red light therapy are definitely there's definitely a lot of research on that. I see that myself. You feel more of a glow, and feel more energetic and lively. So yeah, all those things go together. Yep.
Rahul's talked a lot about the importance of preconditioning with with red vibe therapy and getting under the light prior to treatments. Um, how do you think about that in when it comes to implant dentistry?
I think for implants, and we do a lot of extractions, wisdom teeth as well. If somebody's pretty healthy, I think that going through you know your surgical protocol and getting those things move forward, we can do the red light therapy at the time of surgery. That helps to decrease inflammation, and also the platelet rich fibrin that we can use during the surgery. Those things help out. So I don't know if somebody who's real healthy and everything would need it for preconditioning, but patients who we were doing major reconstructive work on and maybe on some medications, maybe their health isn't as great, that can be a game changer for them. That can be a game changer is how they feel during the procedure, having the body ready for the implant and having them get everything going. So So I think for those patients, it would definitely help out. And, these are patients who are doing full mouth set of implants and more reconstructive work with teeth that are ailing and failing. And, those teeth and wearing them down and really drains on the body. So preconditioning them absolutely will help.
What's the recovery time like after the full implant? I know there's different versions of that, but is that weeks, months? What's when they're like fully able to eat and get back to kind of a normal life? I'm just wondering. I've obviously haven't done those before and not super familiar with it, but can you explain kind of the um, that kind of flight path for them?
Yeah, implants are amazing as far as the healing afterwards. We have different surfaces on implants now that stimulate bone. They're bioactive. So the surfaces and the textures have the same relationship as bone. So the body goes in there and says, "Hey, this is something I want to be around. This is something I want to grow around." When the implant first goes in, it goes in by mechanical stabilization. And then you start to have the process of bone integration, where the bone is and turns over and actually grows and fuses to the implant. So that usually happens over about 6 weeks to 2 months. The bone actually fuses around the implants. As far as the initial healing is very quick. We can place an implant at 9 o'clock in the morning, and if the patient's not sedated, they can go to work. They can go to work during their lunch hour. They can eat. Usually have them have a softer diet, not liquid diet, but softer diet, like eggs are really good, fish is good, and they can really go about their daily lives. For someone who's missing a front tooth, many times we can take out the tooth and put the implant in the same day and put the temporary tooth on the same day. So they can go back out and feel like they have a fixed tooth in their mouth, which is fixed with an implant.
Wow.
For patients who are missing all their teeth or all their teeth are breaking down, we'll usually do our surgical planning beforehand. We'll do a surgical guide based on our 3D analysis. We can also have a prototype restoration developed so we can take out the teeth, place the implants the same day, and place the teeth the same day. So we're placing a full set of teeth. Those patients are naturally functioning that day on the implant teeth. So same thing where it's a softer diet, fish, maybe chicken, eggs. Doesn't have to be a liquid diet, and they can chew and eat. And that actually feels more comfortable than if you just take teeth out because the reparative process and everything you're taking out, you're replacing with implants or platelet-rich fibrin or the bone graft. So the healing time is incredibly fast, and usually after about 2 or 3 days, swelling has gone down with red light with photobiomodulation. Uh, Swelling is very low for implants.
That's incredible. I didn't realize it was that rapid.
Yeah.
Pretty amazing.
So how do you see the next generation of implant dentists redefining standard of care as more biologically supportive technologies become mainstream?
There's so much research we have available. We have so much test of time now with implants. We can start to see how things work, how our implant surfaces impact healing, how body changes, and how diet can help. We talked about diabetes earlier. There was big studies in the 80s and 90s on diabetes to figure out how this can happen and how we can overcome this. So we have also at our American Academy of Implant Dentistry meeting, we have great lectures on diet, nutrition, what different medications can affect dental implants. And so, yeah, it's a very exciting time. There's a lot of information available, and somebody who wants to learn has great mentors, the great courses you can take, and all these things allow us to provide better care for our patients. It provides better access of care with our ability with 3D planning, guided surgery, and biologics. It's a lot of fun. It's a fun time.
It is.
That's great. Rahul, you have any questions
No,
anymore?
I mean, I guess one of
Yeah.
the things that I've been seeing as Redvive, and we're going around the country talking to a lot of different doctors and different meetings. And even in the regenerative medicine space, like, my origin is for spine and joints and regenerative medicine. Um, I guess, the whole peptide world is super interesting to me. Um, and I like literally every conference I go to, there's a discussion or topic. And I know it's kind of like in a gray area with, FDA clearance and, uh, some of them go back and forth on different lists, but for, their regenerative capacity, it is it's totally fascinating. And I don't know if that's something that, is coming across your desk or you're
Yeah.
having patients ask about it, but it just seems to be proliferating. So I couldn't finish the podcast without at least asking you what you're seeing.
Yeah, I think there's a lot of great potential with peptides, a lot of great potential with antioxidants. We really want to reduce the oxidative stress on the body. Those things build up over time. Um, glutathione, glutathione is one that's excellent. You can glutathione is a master antioxidant. I take glutathione, uh, liposomal glutathione. Um, is in a small capsular form, and it seems like it penetrates better than oral glutathione. So it's a pill that you would take, liposomal
Well,
glutathione, and it really helps the oxidative process. It helps the body. You can also do IV glutathione treatments if you're getting things started, getting the body set up. IV glutathione works well, and NAD plus. NAD plus is a great peptide, and
Mhm.
uh, once again, it helps mental clarity. It helps the body regenerate. It helps at the cellular level, and those are two great ones. I also have vitamin B12. Vitamin B12 is just so important. It's important for clarity, for mental clarity, for energy. Vitamin B complex is also important as well. So yeah, I think there's a lot of great things with peptides, and I think that there are podcasts that talk about peptides, and some of my leaders at American Academy of Implant Dentistry talk to them about what they're doing. Some of my colleagues here who are older, I'm like, they're in great shape and they're energetic, and I'm like, what's your protocol? And you start to see that, the peptides and the glutathione uh, come up more and more. What are some of your thoughts? Do you have some favorites, Dr. Desai?
Well, I've been the ones that seem to get at least so much. I mean, I'm just starting to kind of get into it and read more about it, but the ones that seem really compelling, especially for regenerative medicine, and I was surprised actually, uh, was semaglutide. And so some of the GLP-1s are showing tremendous ability to help with tissue regeneration. There's actually studies now on osteoarthritis, cartilage degeneration, and healing with semaglutide, which it was new to me. I hadn't heard that, and I just recently came back from a conference. And then the one that's kind of the hot topic is BPC 157, so body protective compound 157. And the issue with that though is kind of there's some regulatory concerns, and so the docs and whoever's using it just has to be careful. Like there's um, the oral form versus a injectable form. There's some more leniency with like the oral forms of BPC, and then you talked about like the bioavailability, like making sure that there's like a transferrin or lactoferrin compound that allows that to be protected from the stomach acids. So that's one that's really exciting. Um, and then one of the other, this is maybe like a very basic question, but when you're talking about the oral microbiome, when patients are on like probiotics and things like that, will it affect the oral microbiome as well, or is that mainly just gut? Or how do you affect that? Like if a patient comes in, obviously if they're losing their teeth, something's going on with that milieu. And so,
Yeah,
what uh, is there some commonality that most patients are there's some overgrowth of a specific um,
yeah,
bacteria, or what do we normally see?
yeah. I think the most destructive bacteria in the mouth is P. gingivalis. P. gingivalis destroys bone. It destroys the periodontium. P. gingivalis has also been cultured in the aorta, in arteries, and can cause cardiovascular issues. It doesn't go away once it starts to go there and develop and gets caught in these arterial clots. It stays there and affects the whole body. It develops such a strong inflammatory response that it hurts the overall health. There's a lot of my alma mater is University of Buffalo, has a lot of great lectures, research that come out over the years, going back to the 80s and 90s, about the effect of periodontal health and overall systemic health, and also a low birth weight in children. So it definitely affects the whole body. There's a group out here in California, and many also feel that P. gingivalis, because it crosses the blood-brain barrier, could affect cognition and
Huh.
also develop issues with dementia and Alzheimer's and Parkinson's. My
Oh,
grandfather had Parkinson's. It's a very tough way to go, and a lot of groups now are looking at the oral systemic effect all the way to the blood-brain barrier. So all those have an impact. We're talking about implants and regenerative health, and this is awesome, but it comes down to, getting a checkup with your dentist. If it hasn't been a while, I have patients all the time. They come in, they're like, I'm so embarrassed. It's been so long since I've been down to the dentist. I'm like, you know what? You're here. You're here. This is a good first step. Getting in, letting us know how you feel is the best thing that you can do. We'll talk to you about what we can do for you, how we can help you. But knowing that they've come to the office, that is the best step that they can take. So anybody who's concerned, or anybody who hasn't been to the dentist for a while, I would encourage you to get down for a good checkup. Let them know that what you're worried about, what you're concerned about, and it can get you back on track.
excellent. So the best prevention is prevention, cleaning
Best,
and
yeah,
right.
yeah. Best prevention is prevention. Based on what you need, there's a lot of treatments you can do. General cleaning, you can do deep cleaning, you can do laser therapy to help with the gums, photobiomodulation to help to decrease inflammation. But it all comes down to decreasing the inflammation that your body has to go through.
Yeah.
Whether it's oral inflammation, GI inflammation, cardiac inflammation. You have to figure out what the issue is. If you're tired and lethargic and run down, you have to figure out a way. Those are some things with your physician as well. Get down, get your lab tests, find out where the deficiencies are, find out where the missing links are. I will say, for the red light therapy, I was really excited to use and implement it. And so I was using it, I felt great. And then there was a period of time I started to feel a little bit more tired. So I talked to Dr. Desai and Rusty and Mike and JDev, and I said, I'm kind of feeling a little tired. And they said, well, what's your protocol? And I was using it basically too much. I was using it because I love it. I'm like, if this is good, then more is better. So I was using it more in the morning and too long at night. And so now I'm down to lower doses. It might be 3 to 5 minutes in the morning, and maybe 8 to 10 minutes at nighttime. So it's not a huge time that you need. And as soon as I made that change, I was back to feeling energetic and feeling good. So that's something that I didn't really realize that lower doses could be just as effective and more effective. So understanding research and the protocols from Dr. Desai,
Mhm.
that's been awesome as well.
Yeah,
That
we
just
really
goes to
talk
show
about.
you.
Oh, go ahead.
No, I was just saying that it just goes to show when Dr. Desai is talking about this is a medicine, that
Yeah,
light is a medicine, that dosing is very important. And Rahul, you could speak to that, right? The importance of dosing properly in the
Yeah.
protocols.
Well, we've had this is like Matt was saying. It's ancient medicine, right? It's sun, it's light.
yeah,
It's so cool. It's almost like spiritual that we have this ability to use this. You can go out and get it, but not all of us can do that, right? It's not always available. I live in Portland. It's pretty cloudy here a lot, so we get a little bit of that filtered. light or it's dark. And this is a wonderful supplement, but it is all about dosing. Like we've had this medicine for a long time, but I think we haven't had the ability to dose ourselves like AM and PM. That's when the body wants it, right? And it doesn't need a lot. Like you said, this kind of microdosing effect that if you look at how many joules that energy that's getting into the tissue with these small doses, it accumulates. It's like Warren Buffett, like we're putting, money in the bank and it's compounding. And it can have a, really profound effect over weeks to months. Like it starts to make really big differences. So that's what's been fun to watch and hear the stories of folks that are using it. But yeah, if you flood the area, you could drown, right? I mean, the cells are like fatigued, and you can get, you just get overstimulated. And I think a lot of folks, because it works on inflammation right away, like it works on capsaicin receptors, so pain reduction. So if
Yeah.
somebody's in pain or inflamed, it feels so good right away. And then you're like, okay, if that's feeling good, I'm going to do more and more and more. But the biologic part of it, the healing, it gets overstimulated, and that's when you feel fatigued. So you got to titrate, and everybody's a little bit different. Body can, like for me, Matt, I do 7 minutes AM and PM, and
Yeah.
that's like the sweet spot for me. But it took me months to figure
Yeah.
that out.
Yeah.
I meditate in front of it. It's powerful.
Yeah.
It is.
Well, thank you so much for being on. It was an absolute pleasure. We're super excited to come to Arizona and
Yeah.
meet with all the brilliant minds that are in this field and learn and and teach at the same time. And really, we appreciate that invitation. And your team has been so kind. So we're really excited to get down there and meet everybody and talk shop. It's so much fun.
That's great. I look forward to seeing you there. Looking forward to your lecture. I know our members are just going to love it.
Thank you.
Great.
Yeah, thank you for
Well,
your time.
thank you so much again.
Thank you very much for having me.